We are honored today to have with us Adele James, who has an over 20-year history of working with public, nonprofit, and philanthropic sectors with her work with Adele James Consulting. And she consults on a variety of topics from organizational development to fundraising to one of her main activities is assessments and implementations of equity and inclusion practices. And so she has worked with many organizations developing cultural responsiveness toolkits and action plans to help them with their cultural responsiveness. So about a month ago, one of the committees at the church known as WISE, which is being welcoming, inclusive, supportive, and engaged on mental health, was talking about the radical disparities with regards to race and the pandemic. We're seeing that in some counties, 60% of those who are dying are Black, and that 2.4 times the rate of white deaths are seen in the Black community. And scientists doing research on this have seen that death due to COVID-19 can be traced to a long history of lack of access to healthcare, and that any lifetime of not having the same equitable access to healthy sleep, healthy eating, healthy healthcare can lead to higher rates of morbidity because of this disease. And so we wanted to talk about race and poverty as it related to the pandemic. And so we lined up a series of speakers beginning with Adele. But obviously we know that systemic racism, this is not a new issue related to the pandemic, but is rearing its ugly head again and again. And of course, horrifically with the murder of George Floyd this week. And so this is on the forefront of all of our minds, and we are honored to have Adele sharing with us about racial equality and mental health today. So we're going to turn it over to you, Adele. Thank you so much for being with us.
Yeah, thank you. So I just want to say thank you for acknowledging what is going on out there, right now. And I also want to acknowledge the church. Jennifer shared a little bit with me about some of the work that your church does in terms of bailing out, women, but also to some of the work that you've done in support of immigrants. And it's interesting because just you're even raising the name George Floyd. I didn't expect that I would have feelings about that. I don't have cable TV. But I keep up, but one of the reasons is the day-to-day sort of onslaught and the impact that can have. So I try to monitor what I watch or the amount of it, because of the emotional impact that it can have. And, I do a lot of work. It's been a passion and an interest of mine, work around mental health. The monies that went out for the Mental Health Services Act for prevention and intervention, really, how to prevent the deterioration of mental health. I worked on that. That was $140 million that went out over a 4 to 6 month period. I've recognized that in my practice as an organizational consultant, development consultant, that it's not just about the organizational issues that people are experiencing, but mental health and how we show up, what we bring from the rest of life impacts that. And so that's what led me about 6 years ago to get certified
I'm gonna put me on block.
as a coach, because I realized that I needed to be able to support people with what was happening for them at work and how they were addressing it. I'm also certified, a certified mental health first aid youth and adult trainer. So I have awareness. And yet, you know, at points it surprises me. So here's what I want to start with saying is that the protests that have been going on, coronavirus, and those that you see who are most impacted by the downturn in this economy, they are all linked, and the root causes are all the same. If you look back, the root causes are all the same. And so, you know, I want to talk a little bit about just the emotional impacts all of this can have. I worry about, I don't condone the violence. And I understand how it can be like a pressure cooker when you have had challenges laid on a community and the same things bubble up. This is not the first time these things are occurring. You know, from the civil rights protest, you know, to the riots in Los Angeles. And that it's so regular these days of some other incident. And so when you look at the impact that it has, you know, on communities, but also to immigrant communities, that what you're looking at is the stress that racism can cause, but also what it can do is cause sort of chronic low-grade inflammation because of individuals who feel that they have to be constantly on some sort of alert. I recognize my privilege because of my education and my economic status. And I don't see privilege as a bad thing. I think the issue, though, is what do we do with what we have and the responsibility that we take in order to mitigate the power imbalances that others are experiencing? And that's really the issue there. You know, I think back on being pulled over a couple of years ago, and I wasn't on the phone. You know, my hands were at 10 and 2. Everything is registered, signaling, you know, everything I could possibly do. Coming from a dance class, so I'm pretty relaxed. And I see a car next to me and I look over to read the writing out of curiosity. And next thing I know, there's sirens and lights and, you know, I'm being talked to. And I'm scared. I'm like wondering what. Well, I got my answer when I pulled over. The first thing that the CHP said was, "Good evening, sir." The way I wear my hairstyle, it's shaved on the sides. And so what he thought he saw was a Black man. And because of class and privilege, I know the local police captain because I've done work with him. And so I can name drop. And I thought about, you know, he let me go. The first thing I said to him was, "I know the police captain and I've never been pulled over." And he came back later on and said, "Because you don't have a record, I will let you go." I'm not sure why he thought he could keep me to begin with. What I know is I was pretty shook up and had to pull over and just sobbed because it scared me so much that there was nothing I could do. And it wasn't just that one day, but the next day, the impact I felt emotionally, as though I was just being sort of slowed down. It was kind of like a trauma. And I said, and I said to someone, I feel as though I've been hit by a truck, and I thought about this because later on I've done these talks with this man who, on trauma in the African American community, because many folks don't even know they're experiencing trauma and what that looks like, and being continually on guard. And he'd been pulled over 30 something times. So I think about and in a year, what the impact was for me just once, and the impact for this individual and other individuals. So what does this have to do with Corona? Scientists are now starting to do research and uncovering that the stress of racism wears on the immune system. If you look at the rate of life expectancy in some communities versus others, especially in communities of color, the life expectancy is lower. Birth weight outcomes, if you look at women of African descent who are well educated, have health insurance, they are more likely to die in birth, and they are more likely to have low birth weight babies. There isn't anything else explaining that, and one of the things is around the concern they have and holding back on sharing what they're experiencing when they go in to see the doctors, because of concern that they are going to be perceived as loud, as aggressive, and so not really speaking up. So there's a series that was done by NPR, if you're interested, You, Me, and Them. It also looks at the stress of racism for the Latino community. And in one community, they looked at a raid that occurred where everyone who quote unquote looked Latino was arrested. Later on in that year, what researchers saw, and these were in communities in that state, hundreds of miles away, Latina women who were citizens, the birth weight for newborns in the state dropped by 25%. The only thing correlating to the lower birth weight outcomes in that year, which had never occurred before, had to do with this highly publicized, militarized raid on the Latino community. So when you look at Corona, and when you look at who is dying from this, a lot of this has to do with underlying health causes. If we look at what we refer to as the social determinants of health, it's how people live, love, laugh, work. It's really the environment that you grow up in. That there's a historical reason why you see communities designated as they are. It goes all the way back to redlining, but even before that, the communities that African Americans were allowed to live in, and then later on where communities of color were allowed to live in. When you look back on redlining, what it refers to is that people of color were not allowed to purchase homes in certain communities, and had challenges even getting loans to do that. What that ended up meaning then, and this all ties into economics and poverty, how Corona has played out. So the quality of life you have is dependent on the economics, and the economics of your community impacts the quality of life. If you live in a community that is seen as having lower, it's lower income, what that means then is that there are fewer tax dollars to go to schools. Fewer tax dollars mean then that you don't get the type of teachers that you want, and you don't get the extracurricular activities for children. What that then means is that those children don't get the quality of education that they need and have a lower chance of getting into quality schools. even if they manage to get into these schools, they often are not as successful because they didn't get the start they needed with the quality of education. The quality of education that you have determines the type of job that you can get. The job that you can get then determines the kind of health care that you can get. And so there's this cycle, and the education and the job you get then determines the wealth of your family. And how we build wealth in this country is through education, and it's through home ownership. Now, I had the opportunity to sit on the admissions board for Stanford, undergraduate admissions. This is probably about 10, 11 years ago. And they look at a whole lot of data. That was an extensive training. It was a week of training that I spent on that campus. And what they know are the demographics, or rather the economics of the different communities without even visiting them. So, looking at, some communities, I'll take Sacramento. Land Park is a well-to-do community. Oak Park is a historic Black community and lower income. That they know the difference between, you say you have two students who are cum laude in a high school in Land Park and in a high school in Oak Park. That the school actually knew that those two grade levels were not the same. That I did not know that they were aware of that. So that was an eye-opener to me, this awareness about the grade level. And so all of this plays into, those are neighborhoods then that don't have access to healthcare, that those are the communities where folks may not be working in the formal economy. So it's not like they're going to get laid off and then necessarily can apply for unemployment, and so there's a lot of these factors. And then there's the historical distrust of the healthcare system, where folks are less likely to even want to go in to get care. And there's a long history of that. So if you look at the communities that have been redlined, you can overlay them with the same communities that during the Great Recession in 2009 had the highest level of foreclosures. And then if you overlay Corona, it's the same communities being hit time and time again. And so, I understand the despair and the anger, and even doing the sort of work I do, it leaves me wondering, is this ever going to change? I think we have, and I've been looking lately at, even internationally, the impact. It comes down to poverty and economics, and who gets access and who doesn't. And it's not enough to pull yourself up by your bootstraps. I think it's about looking at the systems that hold these things in place. And one has to ask the question of, it's not enough to, when an incident occurs like George Floyd, that it's that one officer, because there have been too many of those incidences. We have to sort of step back and look at, what are the structural issues? What are the policies? What are the practices? What are the procedures? But also to individually, behavior and attitude. What is the responsibility, just as a country, to bridge that gap? Because this one-on-one thing is not doing it. And that is why we're seeing these outcomes. There's a lot of talk about the African American community. And it's serious. In New York, when you check the data, it's African Americans and Latinos. But what we're not hearing as much about is the Navajo Nation. And the rate of corona for the Navajo Nation is even worse than New York. So there are some communities that are even invisible. And the rate for the Navajo Nation, it's something like, you have for every 100,000 people, you've got 2,300 in the Navajo Nation who've been impacted by COVID. New York, it's 1,800 for every 100,000 people. New Jersey, it's 1,600 for every 100,000 people. And something I learned about the Navajo Nation that I was stunned to find out, this is the United States. This is a developed nation. This is a first world country. And yet 30 to 40% of the people living on the Navajo Nation do not have running water. This is 2020. And 30 to 40% of the Navajo Nation doesn't have running water. But also culturally, you have that they live in poverty and many individuals in a family live in the same home. So imagine that, social distancing, when you've got multiple generations in a household, to social distance is a privilege and a luxury. Not everyone can do that, and then on top of that, not to have the basics of running water, which is a basic requirement for, preventing the disease. And so I think in terms of what we do, I think it's bringing attention to the disparity and the systems that hold those things in place. I have been doing these trainings on cultural responsiveness for a couple counties through California Institute of Behavioral Health for Sacramento County and also Fresno County. And what I've used is coronavirus as a way to help the staff look at how this is playing out, but also what they may be able to do, what sorts of questions to ask in order that they are better prepared to serve the folks that they're working with. The reality is that it's really hard for them. Resources are limited. And I'm hoping that through the training, that they're at least aware of some of the things that communities are facing, and so that they can make more informed decisions about the limited resources that they have and how to share them. But some of the things that I've been hearing them talk about, this learning at home or homeschooling, you have a lot of children, especially in lower income communities, who have not received laptops. Whereas I know Christian Brothers, which is the, sort of top private school here, that's been a done deal for ages on the switchover. There's an assumption that if you have a laptop, then you're going to know how to use it. But you're talking about parents who may not have the education knowledge about the laptops. Those are also communities where they may not have Wi-Fi. And so you may have the laptop, but you don't have the Wi-Fi, and then your parent may not know how to use it. Everyone's using Zoom. Well, almost everyone. For folks in lower income communities, they have what they call the Obama phones. And they can't, their phones given to the community, that it requires bandwidth and there is a cost to streaming. Those phones can't use Zoom. So these are some of the things, and even the impact of this changeover for the LGBTQ community. I actually asked folks to talk amongst themselves about the impact of COVID by race, the impact of COVID by gender, and the impact of COVID by class. And so this is some of what each of the groups came up with. For transgender people, for some, it's made it even harder because where they live, where they're not accepted, they now have to shelter in place with the very people who don't accept them. For others, this one young man who's transgender was happy to shelter in place. He has a family that is accepting of him. However, it got him away from being bullied at school. So there are all these, and the idea of shelter in place. I say to the group that, we all have different levels of privilege, and that we're here being paid for a training on Zoom is not the experience of everyone else. And some don't have a choice, but regardless, to go out, to earn income. And in particular, if they're in the informal economy, which puts them at greater risk. So, I guess I want to say, I see, thank you for the activism on behalf of the church, because I think you're all in a position of individuals who can bring attention to what's going on here. Because, the reality is that some voices get heard more than others. And so, to speak up about these differences and these root causes, because this is not, they say this is, we just weren't prepared for a pandemic, that there are going to be others, and that it's going to continue in the same way. We're only seeing the start of this downturn. When you think about the homeless and other individuals, again, being really impacted significantly by this, and that, the recovery is going to be longer for those who are impacted the most, and that has to do with socioeconomic status, that has to do with race, that has to do with health disparities, and with all of those things. So, I hope that maybe this is a wake-up call, and acknowledge that there have been many of them. But then one can't just stop either. So I think that's where I'm at, Jen. Thank you.
Adele, is it okay if we ask some questions?
Yes.
Question. Does anybody else want to kick off?
Yeah, thank you, Adele. If you have a question, anybody, just feel free to unmute your microphone and jump in and ask.
So Adele, I could start. I think going through COVID and seeing the disparities, that was one thing. I think watching the protests that are happening right now and the attempt by many to do peaceful protests and then have, in the midst of peaceful protests, violence erupt. And I know that people talk about this a lot. I feel this sense of, helplessness. Mm-hmm. And this real question of what is correct action? I think that's the thing. What's the correct action right now? And so I don't know if it's a question as much as just a comment, that I think that this discussion came up in the midst of COVID as well, because a lot of people in our church do incredible amounts of social justice work, and yet during the shelter at home, when folks couldn't leave, there was also, again, this sense of privilege and helplessness almost as a result of that privilege.
Yeah.
So any thoughts about this?
You know, I think it's to keep pushing at the structural issues and the practices that cause these disparities. There's been talk about, you know, why not give communities equal resources for schools, and that it not, you know, that the quality of education that a child gets is not dependent on the tax base for that community, you know. And so I think it's looking back at what is causing these differences in health access, and that there is an overhaul that needs to occur, because right now it's really dependent on economic access, and that's not occurring. So what do we do here that folks, you know, can have more equal access to jobs, to income, to healthcare, to education, all of those factors. But I think as well, I think it's to push on those things around the policies, the practices, and the procedures, and taking a look at what's going on right now and who's impacted, and examining that, because the data is there. I mean, when you see these numbers, the data is there. And so why not take a look at what this data is showing you and figure out what to do? And I don't know if it's to push electeds and keep raising that as a topic. And I feel, you know, what I try to do in my work is help people understand how we got here and what the disparities are, and you know, to sort of speak up on behalf. And it's I guess it didn't happen, none of this happened in a day. It took hundreds of years. And so I, you know, I think at points to sort of stop and say it's the continuing effort and consistency, because the problem is consistent. And so it requires consistent effort. And it's not about individuals, you know, Amy Cooper, you know, Central Park Karen. I'm not saying that she shouldn't be held accountable, but the bigger issue is what's going on that she could rely on the idea that if she called police and said her life was in danger from someone of African descent, that she was pretty hopeful that would result in some consequences for him. And so some of it is the policies, the practices, but also like, what is the implicit bias piece here that's going on? And for folks to start to sort of recognize that and the role in perpetuating that. So it's not an easy answer, and I am, some days I just need to take off from it, you know, and yeah.
This is Lori Giesenhagen. I have a question. When you mentioned the Navajo Nation, it reminded me that Doctors Without Borders are currently working in the Navajo Nation. And it just really struck me as to where could I find out more information on how people don't have running water? I mean, it just doesn't make any sense. And I don't think that we're aware of that. I know I wasn't. I know about disparities in different communities. My niece lives 3 blocks away from where George Floyd was murdered, and they've had troubles with the Minneapolis Police Department for a long time. But when I heard that Doctors Without Borders, were treating our people in our country like a third world nation, that was heartbreaking. And I guess I'd kind of like to know. I don't understand, you know, because I know that there's different sovereignties, but do you know any sources where I could get more?
So here's the thing. This stuff is all out there. So in wanting to be prepared for doing these trainings, um, I wanted folks to see a wide variety of information about the impact of COVID. If you look up COVID and health disparities, COVID, Navajo Nation, you know, and a lot of it were reports by CNN. I've even found something that's looking at the global impact of COVID, and naming sort of human rights in connection to COVID. And so if you look, COVID and Navajo Nation, COVID and human rights, COVID and racism, and there's a lot of information and reports that you will find, and just Googling. And so I think just having the awareness, because most folks I think it was just preparing to do this training that I came across this information on the Navajo Nation, and really wanted to highlight that because a lot of what we're hearing is the impact on Black and Brown communities. And that's heartbreaking. And what's going under the radar. And again, the historical connection. So, you want to talk about a version of redlining and moving, Native Americans onto reservations, and Native Americans having to apply for and be given citizenship to the United States in the 1900s. Those are all impacts, traumas that affect mental health. They have some of the worst health outcomes. And so combine that on top of the spread. So that's where I would look. I hope that helps.
It does. Thank you. I knew about the water, but it's just God speaking to me. He says, this is something you really need to study, figure out what's going on and what you can do. Thank you.
Adele, a question from the comments from Camille. How can the Black community improve health and reduce stress in light of everything that you said today? And I know that just the emotional weight of these systemic injustices can be too much sometimes. So what tips or strategies do you have?
Yeah, so there's a larger issue of, so they in prevention, right? Health prevention. They talk about, okay, here's the thing. There's a whole thing, and I will answer that. And there's this thing about, if you're finding that you can start at the level where how the community can prevent this, and ultimately it won't get at the root causes, which is you got to go upstream, as to, what is causing the impact on mental health. So a discussion in the African American community, we know that masks help. But there was a question or a discussion as to whether or not Black men should wear a mask. So it was the risk of COVID or the risk of, being viewed as an even greater threat as a Black man with a mask. So that was another one of those things on CNN where there was a whole discussion, people choosing not to wear a mask, where Black parents are having conversations with their children about what they should do in the event that they are stopped by police. and you can go on Google it, and you will see it's heartbreaking that like one guy running through the drill with his 8-year-old daughter, you know, about what she should do and put her hands up and say she's unarmed, you know. So there are things that like that, and then there is, why is this happening to begin with? Now, as to dealing with the stress, you know, during the last election, and this is a little long-winded, I am a Trinidadian by birth. I became a US citizen. And after that last election, and I'm used to going anywhere I want. You know, I covered rural areas from Sacramento on up to the Oregon border as a program officer for a foundation. And so I covered rural and frontier, and I would go up there on my own. I don't have no issue with that, you know. But that after this last election and the rhetoric, I found myself feeling afraid and wondering, who is it that voted for someone that, you know, my identities as a woman, my identities as a person of African descent, and my identity as an immigrant all felt threatened. And so I wondered, like, who? And so I really felt like I needed to find support, you know, with a group of African descent who would understand this. And I found something called emotional emancipation circles by and for people of African descent to undo the lie of Black inferiority and white superiority. I participated in that group, and it was a safe space for folks to just talk about what was going on. It was at that time that in Sacramento, Stephon Clark was murdered in his grandmother's backyard. And that group then decided that in response, because recognizing that you had a lot of folks in the community who were being impacted and not even knowing they were experiencing trauma, that group then decided to hold what they called Safe Black Space. And it was an opportunity for folks to talk about what they were experiencing, and also to, there was discussion about what trauma looked like, so folks could recognize it, and it also provided resources for addressing that. Safe Black Space was in part set up by, I think it's like Therapists of African Descent. And if you go online, there is a website for Safe Black Space. And now with COVID-19, there are now online versions of Safe Black Space that are occurring. And so I would check that out as a resource, you know, and it's about finding support and someplace others with whom one can feel safe in sharing about what you're experiencing. Yeah. Yes, Mel.
Thank you, Adele. This is a very important gathering, and your message is being heard and appreciated. I'm an economist, and I am aware of the structural inequalities and racism that exists in the country and in other countries as well. But we have a particularly virulent and bad case of it. My wife and I met in Michigan, and the deed on our property in Michigan, our grandparents bought that property, and in the deed it says, "This property shall not be sold to persons of the Jewish faith or the Negro race." Mm-hmm. Of course, that restrictive covenant has been ruled illegal, but it's still in the paper. It's still on the deed. And the number of people in that community that are Black or brown is terribly small. And the structural inequalities, the average wealth of a white family is 10 times the average wealth of a Black family. And that comes from slavery and discrimination in the workplace and in education and healthcare. Black people don't vote at the rates of others, often because they died. Their life expectancy was so much shorter that there are several presidential elections in the United States that were determined by the margin of Black people who died with the lower life expectancy. This is, our country is built on racism. And you've pointed out today the building blocks, the structural determinants. And so this is not something where we're going to have a couple of sessions and fix it, pass a law or elect some person and fix it. It's going to take all of that. And it's going to take a consciousness raising, a partnership, and you are a key witness, bringing expertise and life experience to this. And we need to have many more sessions like this. And we need to do the work, which will be long and hard, but we're not going to make progress unless we tackle it. This congregation has worked hard on LGBTQ equality, but we need to work harder on racism. And I just want to thank you for being part of that journey.
Thank you. And thank you for your sharing, Mel, because I think that with your knowledge and background, and you've provided some context and to share that so others understand. You've even shared I've learned something from what you've shared there. And, I'm mindful of saying too that I am from Trinidad. So, that my experience has been, as a person of African descent, and that, by mere fact of my birth, that in the ranking, I had a better chance of getting into the schools that I did, because they are more open to people of African descent from outside of the United States than they are to people from here. So I'm fully aware of that, and to speak to those concerns. And just I just thank you all for listening today and inviting me. And thank you again for the work that you guys do on behalf of these different communities. Yeah.
Well, Adele, this has been really helpful and informational and educational for a lot of us. And I think as we're all searching for the next steps, you've provided us with a lot of food for thought and a lot of resources and things that we can continue to talk about as a community. We just want to make sure that everyone knows the conversation is not going to fizzle out. It's not going to end here. We are going to continue talking about these issues and finding ways that our community can really take steps forward. We don't want to just sit in our feelings of helplessness and hopelessness. That's the opposite of what we want to do. So again, thank you, Adele, for your wisdom, your thoughts, your experiences, and all of the thoughts that you shared this morning. I know everybody's virtually clapping. Do you have any last thoughts as we wrap up?
Yeah, everyone, just to reiterate what Jen said, that we're going to be creating follow-up sessions, more opportunities for dialogue. You'll hear today in the service that we're going to start an ongoing kind of book discussion group on racial justice and cultural inclusion. And Adele, thank you for kind of showing that all of these issues are wrapped up into each other. Like, we can't talk about this without talking about poverty, without talking about the way our country treats the Navajo Nation, that just these incredibly widespread systemic issues require our concerted effort and focus. And honestly, as pastors, we believe in the separation of church and state, but this election cycle right now is like a moral and spiritual issue for us to get people who are going to take these issues seriously. It's essential. And so thank you for raising that issue as well.
I see you guys are putting a whole lot of resources in your chat box, and I don't know if someone can copy it. I'd love to see some of them. So there's a way to do that. You can actually send it as an email. I don't know how to do it, but there's a lot of good resources in the chat box that folks, Leah Mercado has put something in there. Jack Mills put something in there. So I'd love to be able to, yeah.
Yeah, everyone, if you're able to see the chat function, you'll see some resources on Navajo Nation and a book on housing policies that someone recommended. So we'll see everyone in worship in a few minutes, and the conversation will continue as we continue to mourn the tragedies in our country and do the important anti-racist work that we need to do. Thank you again, Adele.
Right.
Thank you.
Thank you.
Take
Thank
care,
you.
everyone. Stay well.
Thank you.
Thanks, Jen.
Thank you.
Thank you. I'll talk to you tomorrow morning.